Now, I invite Dr. Tan Melan, who will be joining us from Malaysia over the Zoom platform. I request Tan to give insights to nutraceuticals and functional foods. Over to you.
Supplements are really a broad area to cover in 15 minutes, so I'll just go through very briefly here. We will look at significance and precautions. Now, some definitions. Now, Dr. Stephen D. Fellis coined the term nutraceutical and from nutrition and pharmaceutical. That was like in 1989. So D. Fellis defined nutraceutical as food or part of food that provides medical or health benefits, including the prevention and or treatment of disease. The US Dietary Supplement Health and Education Act, or DSHEA 1994, defined nutraceutical as a diet supplement that delivers a concentrated form of a biologically active component of a food in a non-food matrix to enhance health. And ENA, that was the European Nutraceutical Association, defined nutraceutical as nutritional products that provide health and medical benefits, including the prevention and treatment of disease. So you can figure out the keywords here, yeah, prevention and treatment. Now, in fact, some authors would even list down the categories of nutraceuticals, which comprise of herbal and botanical products, food-derived active compounds or related byproducts, vitamins, minerals, protein powder, dietary supplements, you name it. Now, on the other hand, the SHEA defined functional food as nutrient consumed as part of a normal diet, but delivering one or more active ingredients that have physiological effects and may enhance health within the food matrix. So there's no mention about treatment or prevention, yeah? But EFSA defined functional food as a product, which is shown in a satisfactory manner that in addition to adequate nutritional effects, induces beneficial effects on one or more target functions of the organisms, significantly improving the health status and welfare or reducing the risk of disease. So you can see the overlapping with the definition of nutraceutical. So what could be considered as a functional food under a given set of circumstances may be named as a nutraceutical, a dietary supplement, or medical food under different circumstances, depending on its ingredients, active components, as well as the claims reported on the label. Yeah. So when a functional food aids or help in the prevention and or treatment of disease or disorders, it is called a nutraceutical. Now, as for dietary supplements, according to the SHEA, dietary supplement is a product other than tobacco intended to supplement the diet that bears or contain one or more of the following dietary ingredients, including vitamins, an amino acid, mineral, herb, or any other botanical products. So dietary supplements can come in a variety of forms, including tablets, capsule, gummy, powders, and all that. Now, the terms nutraceutical functional food, yeah, are often used interchangeably, and they have no legal definition at the moment. Yeah, so the scope of nutraceutical may include functional foods, herbal products, botanical extracts, and all that. Yeah, so in a nutshell, if a product aids in the prevention and or treatment of disease, it is called a nutraceutical. Now, I would like to stress that the nutraceutical industry is flourishing and diversifying rapidly. Yeah? So the current nutraceutical market trends in healthcare are more inclined towards preventive healthcare strategies rather than treatment and disease management. Why? Well, most regulatory authorities would not allow labeling a nutraceutical for treatment unless they fulfill additional regulatory requirements. In fact, in Malaysia, there's a list of diseases that these products should not mention or claim in their promotional or product labeling. So what makes the nutraceutical market grow at such a rapid rate? You know, why people are consuming more and more of these products now than ever, yeah? So among the key drivers to this booming industry include the increase in aging population, the emerging of the non-communicable diseases like diabetes, cardiovascular disease and all that, and increase in healthcare costs. These factors would have actually made people think, people began to realize the importance of prevention rather than cure. For example, in the case of COVID-19 pandemic, the fact that there was like no specific treatment for COVID-19 and everybody understood that the strong immune system would probably help mitigate the viral infection or may improve healing rates. And this has resulted in people, consumers, looking for products which enhances the immune system. So in fact, now people are already taking high-dose vitamin C and all kinds of products, to create the so-called antiviral immunity. Now, nutraceutical and functional foods are mostly used by consumers in various conditions, like aging, osteoporosis, obesity, neurological diseases like Parkinsonism, Alzheimer's, inflammatory disease like arthritis, cancer, cardiovascular disease, diabetes, COVID-19, to name a few. We will look at the case of COVID-19 and cardiovascular disease briefly. So what are the roles of nutraceuticals and functional foods in COVID-19? Now, the fact is that a number of published evidence do indicate that many nutritional supplements from various sources such as spice, herbs, fruits, and vegetables can reduce the risk or reduce the severity of a wide range of viral infections by simply boosting the immune response. So hence, in the case of COVID-19, these nutrients were repurposed with the hope of mitigating the pathological effects induced by SARS-CoV-2 virus. And people hope that these products may provide alternative, prophylactic, or therapeutic support for management or prevention of COVID-19. Now, products such as zinc, vitamin D, C, selenium, propolis, curcumin, cinnamon, garlic, piperine, probiotics, they all do generally have a documented antiviral, anti-inflammatory, immune booster, and antioxidant properties. And although preclinical studies mostly are favorable, there are yet available concrete results from these clinical studies. So despite that, people are already supplementing themselves with these products as prevention. Now, products such as vitamin C, D, zinc, curcumin, probiotics, and quercetin are currently either as a single component or combination therapy registered for more clinical trials on COVID-19. And in the case of vitamin C, based on a recent clinical trial, oral administration between 250 to 500 milligram of quercetin and 500 milligram of vitamin C for high risk and mild symptomatic patients twice a day for 7 days was actually found to improve the overall recovery among COVID-19 patients. And well, unfortunately in the case of vitamin D, based on several clinical trials, findings are still inconclusive with regards to the therapeutic value of vitamin D supplementation. Now let's look at cardiovascular disease. Now we all know that high plasma cholesterol levels are associated with increased cardiovascular morbidity and mortality. Hence, hypercholesterolemia is a major risk factor for cardiovascular disease. So a number of the nutraceuticals and functional foods used to prevent or treat cardiovascular disease are targeting the cholesterol levels. Now, for example, like fibers such as beta-glucan, psyllium are approved by FDA and EFSA to reduce LDL levels. Approved here means that they are allowed by these two regulatory agencies to use the health claim that this product reduces LDL levels. Phytosterols are also approved to reduce LDL levels. Phytosterols are basically cholesterol homologs found in vegetable, nut, and olive oil. And then you have red yeast rice, standardized to 10 milligram monacolin K, approved for maintenance of normal levels of LDL. Now, the good news are that these products are extensively evaluated in clinical trials. But I'd like to mention about berberine. This is a compound from a plant, So although several clinical trials and meta-analyses have indicated the usefulness of this nutraceutical, both FDA and EFSA has not specifically approved this nutraceutical for health claim. Why? Because according to them, most of the trials that were carried out were actually among Asians. So there was like a debate, whether the therapeutic effects may or may not applicable among Caucasians. And furthermore, berberines and some compounds found in this plant were found to interact with cytochrome enzymes. So hence there may be a risk of drug-herb or herb-drug interactions. But then you have another interesting product derived from tomatoes, trademarked as Fruit Flow. I'm not sure you have heard about it. It is the first anti-platelet nutraceutical to prevent cardiovascular disease and was even promoted as an alternative to aspirin. Now, I'm not promoting fruit flow, but I'm just trying to share with everybody here regarding this product. This is a very interesting product because it is an anti-platelet tomato-based nutraceutical product that has been granted permission to apply a health claim on the product and approved for daily intake by EFSA. Right, mainly indicated for the maintenance of normal platelet aggregation. Now, this is after extensive clinical trials, being carried out for this product. So this product is basically available in all countries worldwide using different names. So the interesting part is that in addition to its ability to reduce platelet reactivity or keeping the platelets smooth, fruit flow contains anti-angiotensin converting enzyme and anti-inflammatory factors. So it makes it quite an effective and natural cardioprotective nutraceutical. So the intake of either nutraceutical, functional foods and dietary supplements are generally safe, but not totally without risk. For example, although PUFA, your polyunsaturated fatty acids, fish oil and all that are generally well tolerated and not known to be toxic, combination of these products with products containing vitamin A may cause hypervitaminosis A, leading to vision, skin, and bone changes in the long term. Now, omega-3 and fish oil may also promote anticoagulation, and hence it may interact with blood thinning drugs like warfarin or aspirin. So when we talk about anticoagulation effects, it basically translates to increased risk of bleeding. And then contrary to popular belief that vitamins are safe, they are not actually without risk. Excessive vitamins such as vitamin B6 was reported to cause photosensitivity and neurotoxicity. Vitamins given between 800 to 1,200 milligram has anti-platelet activity, and hence it may actually cause bleeding when given together with blood thinning drugs like aspirin, diclofenac, or warfarin, right? High dose vitamin E, more than 1,200 milligram, is known to cause diarrhea, weakness, and blurred vision. And according to some studies reported, supplementation of vitamin A and E have been associated with risk of cancer recurrence. Now, as for weight loss products, most problems arise basically from adulteration. In the case of weight loss products being adulterated with anti-obesity drugs, like sibutramine and orlistat and all that, or herbs like mahuang or DMAA. Mahuang and DMAA are basically symptomimetic agents. So they have these appetite suppressant effects, and steroids in the case of bodybuilding supplements. All this can actually cause health issues in the long run. Now, as for botanical products, the adverse reactions may actually come from the toxicity nature of the natural products itself. Like, for example, black cohosh was yeast associated with jaundice and liver failure. Herbs like kava reported to cause liver toxicity. Garlic ginkgo supplementation are associated with risk of bleeding. And some of these products also contain polyphenols and bioactive compounds, which also tend to cause herb-drug interactions. Well, they can easily interact with liver enzymes, the cytochromes and drug transporters, right? Now, just one classical example, grapefruit juice. Grapefruit juice is known to inhibit CYP3A4 metabolic enzyme. So grapefruit juice is not advised to be taken with an antihypertensive drug like philodipine. Why? Because philodipine is metabolized by CYP3A4. But so when grapefruit juice is taken together with philodipine, what happens is grapefruit juice will tend to increase the drug concentration of this drug because it reduces the metabolism, right? And it causes toxicity. So as a matter of fact, right, there are a lot of botanical compounds with unknown herb-drug interaction risks. So here are just some of the selected examples, just to stress that precautions are certainly needed with regards to the dose, the possible interactions and adulterations of these otherwise very useful products. Thank you.